Hello, today I'm going to talk about cough cold, which is very extremely common in young children and tend to occur more frequently in autumn and winter months. They're usually caused by infection, and most children get better themselves, and antibiotics do not make them better more quickly. If they find it's very hard to breathe and too breathless to feed, they may need to be seen by doctors in the local hospital. I am sure that you need to know when your child needs to be seen by a doctor. So the red signs like blue lip, pause in their breathing, irregular breathing, starts grunting, harsh noise as they breathe called stridor present all the time, severe difficulty in breathing, too breathless to feed, become pale, mottled, feel abnormally cold to touch, becomes extremely agitated, confused, lethargic, and developed a rash that does not disappear on pressure called class test. And under 3 months of age, temperature of 38 degree or 100.4 degree or above, unless fever is 48 hours following vaccination, and no other concerning feature, then you need to go to the hospital emergency or phone in NHS 999 line. Now, if has any of the following, like labored or rapid breathing, or they are working hard to breathe, drawing the muscles below their ribs, their neck in between ribs, a harsh breath noisy sound as they breathe called stridor only when they are upset, and seems dehydrated like sunken eye, drowsy, not passed urine for more than 12 hours, is becoming drowsy, extremely sleepy, fever of 38 degree or above for more than 5 days, seems to be getting worse. Or if you are worried, these are not red sign but amber sign, then you have to read the GP surgery or call NHS 111 line to get help. Now, if none of this feature I mentioned is there, then you can self-care. Continue to provide child's care at home. But if you are concerned, can call NHS 111 line. In fact, antibiotics don't usually speed up the recovery, and cough cold generally improves without need of any antibiotic in otherwise healthy and vaccinated child. Unfortunately, antibiotic can cause harm. 3 out of 10 antibiotic resistance develops, then that antibiotic not work. So should only be used if their benefits are likely to outweigh their harm. Keep your child well hydrated by offering lots of fluid. If your child not feeding as normal, offer smaller frequent feed. Cup syrup does not tend to help with cough. You can try saline nasal drop or spray if your baby has a blocked nose. If your child has a runny nose and breathing difficulty, most likely have a condition called bronchiolitis, and most of them get better themselves with no specific treatment. I have already mentioned about bronchiolitis in my different section, and I will again discuss it. Hope this little talk helps you. Stay healthy, keep your child healthy. Bye for today.